So they don't know they're infected. Most likely they're young, and they're spreading the virus not only to their friends, but also to their family and potentially to the vulnerable individuals in your community. And so what the colleges have taught us, if we can get testing and routine testing to find that early spread, and stopping that spread before it gets to the vulnerable individuals in the community, before it results in hospitalization, can be much more effective. Really wanted to carry the message of what we did through the summer here and what we're doing now is not effectively stopping the spread. So we have to do things differently. And so we really wanted to talk to the universities of how their model could be utilized to really find that level of community spread for us, the silent spread earlier by testing younger people in the community. And we talked about whether the universities could work with us to test all of their students, the ones not only in residence halls, but also all of their students across Wisconsin, and also bring in the vocational schools and test those students and really get an idea of how much asymptomatic spread there is in the community, how much asymptomatic, those are people that don't have any symptoms, again, that are infected and passing the virus to others but don't have any symptoms of that infection, and how the universities could work in partnership to identify that, and really then talking to the legislators about how this could be brought to county governments and to medical facilities where we can get broader-based, early, proactive testing. We call it surveillance testing, proactive surveillance testing, to find that spread early. What we know is happening now in the drive-thrus, in the CVS's, and in the Walgreens is people are coming forward that either feel like they've been exposed or may have symptoms themselves. And so that's symptomatic and finding them. It's also a significant number of people, what we call the worried well, who are very concerned about COVID. What we need to find are the individuals that are most likely to be out and about, younger individuals who have, again, no symptoms of this virus, but actually are carrying it and spreading it to others. You could almost think of it as a carrier mode, but they're actually infected. And for that 10 or 12 days, they may be spreading virus to others. And so really working at all levels and at all communities and utilizing the universities to get a better sense. And I just want to thank the university system here. They had a great plan to bring students back. I think you can see the numbers have come way down. They're at a steady state situation right now. They have great plans for the spring, but we talked to them about really enhancing testing and really increasing testing to either weekly or twice a week for all students in the spring. And so that was the discussion we had, and I want to see if you have any questions. Yes, sorry, yes ma'am?
Hi, thank you for taking our questions. You mentioned 2 months ago when you were here there were early signs that this could potentially take a turn for the worse here. What do you think were the missteps in the past 2 months that if you saw the signs early that nothing evidently was done to prevent this from getting to the point we are now?
You know, I think it's very hard to find that asymptomatic spread. And at that point, we didn't have suggestions really of how to find it. What we've learned now from universities with their weekly testing, not only can they find it, isolate those individuals for 10 days, but they stop all further community spread within the student body. That we need to learn from and translate to our communities. And I think I want to thank the universities that came back, that brought their students back, because if they hadn't, we wouldn't have been able to learn from them. And I think this is really an important moment to be able to translate what we've learned from the universities into the community.
Yeah, I was curious what you think of President Trump is coming here on Saturday. That brings a lot of people together, as we saw in Janesville last week. Is that a good idea given the amount of coronavirus we have right now?
You know, I give the same public health advice to every single individual. And I'm giving it to the individuals in everywhere I speak to, and certainly within the White House. We have to, as a community, take the precautions of wearing masks and physically distancing from one another to prevent the spread of this virus. We know what we have to do, and really every individual in every single state needs to do that. Now, that said, we have made public spaces a lot safer, and I really want to thank all the people in retail who have really worked together to make public spaces safer. And so people are wearing masks in public much more than when we were in here 2 months ago. What we're seeing, though, is when we know you, and when I know you, and it's in my house, I let down my guard. And we take off our mask, and that's when that asymptomatic spread is occurring. And so it's not just creating safety in public spaces, it's really changing our behaviors in private spaces so we don't bring those gatherings together and take off our masks.
Will a gathering like that, should masks be required?
I am always for masks. You know I have talked about masks unrelentingly. We know masks work. There's new data coming out. I think you've seen the new airline data coming out of Emirates. I find that incredibly encouraging. First, we had the 2 salon workers who were sick and didn't pass the virus to 140 or so of their clients because the clients had masks on and they had masks on. And I know you know that sometimes as women, we have more time together in salons than probably men do in salons. So that was a long time exposure, but everyone was protected. In the airline studies, I can't remember if it was Singapore or Hong Kong that required testing upon arrival. And so when that plane arrived, they found several dozen people on that flight who were positive. They contact traced every single person on that flight, and not one person became positive, and they were masked. Both the people who were infected were masked, although they didn't know they were infected. Again, asymptomatic individuals don't know they're infected. And the others sitting around them had masks on, and there was no transmission, and you're way under 3 feet from each other. And so masks do work. What we're trying to decide and what we need everyone to work on is how far do we have to be physically distanced when we have our mask on? And I think that's still a question that we need to understand.
So should they be required? You said you support them, but should they be required?
I have been supportive of every single governor who has required a mask mandate. We have seen that work. We saw it work in Arizona when Governor Ducey put in a mask mandate. We see it work in Alabama when Governor Ivey put in a mask mandate. We believe, and why we think the mandates are important is because it gives the retailers that ability to constantly remind each of us that we need to continue that behavior. And I know none of us are perfect, and sometimes, you know, we traveled this country. We've been in 36, 37 states. We will have been in 43 when we finish this trip. Sometimes when I get out of the car at a gas station, I get 2 steps in and then I remember. I see the posting on the door. I see the retailers reminding me. And that's how you get behavioral change, is constant reinforcement for that type of behavior. And that's why the mask mandates are helpful.
But if community spread is the problem and people at my house are the problem, am I really spreading it walking through Walmart with or without a mask?
Well, that's why it isn't being spread there. And so as we've decreased the spread in public spaces, it has made it clear how much more spread is happening in the household. So now we can see the household and social spread because you all have done such a better job in public spaces in protecting one another. And again, I just want to make it clear, no one is intentionally infecting anyone else. No one is really intentionally with symptoms coming to their grandparents' house. But when you don't have any symptoms, and I know it's confusing with this virus, because you have 2 people, one of which has no symptoms, and one is so sick they're admitted to the hospital. And sometimes those individuals succumb to this virus. And so you have this spectrum of disease, and we're not used to that. We're used to people having a flu, getting symptoms, going to bed. We're not used to it going from no disease, no evidence of disease, to serious disease and fatalities. And so I know that's confusing to people. And I think I want to really always carry that message. That percent of asymptomatic spread is higher in younger people. No one is intentionally spreading the virus. But the only way you find that is through proactive surveillance testing, so that you can find those individuals by repeatedly testing individuals who are willing to be representatives of their community. Whether they're workers in the hospitals, or county workers, or K-12 teachers, or prison staff, or nursing home staff like we are doing. When I tell you 40+% of every single nursing home has a positive staff, I'm telling you that there are other situations today where people are working. Now, fortunately, they'll have a mask on. Where people are working who are infected, yet asymptomatic. And if we can find them, they will isolate for 10 days and not spread the virus. But if we don't find them, although they may be good in Walmart, they are not in the same behavior when they're home. And so that's why more and more of the spread is detectable in social gatherings at home.
In the summer, it seemed like it looked like Wisconsin was doing a good job at controlling these outbreaks. What has changed? Something has changed.
Yes. Well, the very thing that you heard everyone warn about, that is what changed. Because people had the opportunity in the summer, and we were privileged to be here and along the lake in the summer and see picnics outside and families outside, meeting with other families outside, eating outside, having picnics in their backyard, meeting people on their decks. What has happened is it's gotten cold, and in many cases gotten cold quickly. And so that behavior moved indoors. And when you think everything is fine, and you have this level of asymptomatic spread, the virus then takes off like wildfire because it's finding a lot of individuals in a place where the virus is concentrated and you don't have your mask on. That's what changed. And that's why I don't see the weather improving for several months. And that's why it really has to be a new call to action. We have to do things differently because what we were doing got us here when we moved indoors. And so we both have to change our personal behaviors at home as well as continue our public behaviors.
So are you going to encourage a mask mandate in the home?
So what I have said before to individuals is if you are visiting grandma, if you're visiting your aunt, if you're visiting a family that has a Down syndrome child, as is in our family. I have a niece that has Down syndrome who is in her late 30s. I wore a mask and I socially, physically distanced from her when I saw her because that's how we show respect for one another. And so that's what we're talking about. So if you are having that kind of gathering in your home, or if you want to see your grandmother or your aunts, we have to have that kind of behaviors to really protect them because you don't know at this moment whether you're carrying the virus and could potentially infect her.
Last question, please.
As we enter these months, are there any other tools, if we have mask mandate here, capacity limits, are there any other tools policy-wise that government leaders that you spoke with that you're kind of trying to encourage as people, as you said, kind of focus more indoors?
I think we have the tools. It's whether we can consistently use them. And I think that's hard on all of us. And we just have to admit it's been a long time and people are asking us to do more and more every day. First, we're asking you to do it in public spaces, and now you're hearing me say, but you have to protect grandma in the house. So yes, we're constantly asking you to do more. We're asking you to bridge with these behaviors. Wearing a mask, physically distancing, even indoors, wearing a mask and physically distancing if you're interacting with people who are vulnerable in your households or in your neighborhood. And we're asking people to do that until we can get vaccines available. But I'm also asking for us to do things differently and to test differently. And to really not to discontinue any of the great testing that this great state is doing, but adding on testing that's focused at the community level, doing surveillance proactively to find the individuals in this room and in every room around Wisconsin who are silently infected with this virus. And that will take people probably under 30 stepping forward and saying, I agree to be tested. We are getting antigen testing out to the states. We need the states to not just add those to their current testing methodology, but to do it in a different way to be able to find those young people and to be able to offer them testing in a way that they will come forward and be tested. And to do it in a surveillance way, then you don't need to have CLIA approval. The tests are here. I know a lot of vocational schools that are training paramedics and training nursing students. They can help set up those testing sites really just for the under 30 set, for the 18 to 30-year-olds, and really find out how much asymptomatic spread is in those communities. We've learned from the universities, if you stop it there, you stop the spread across the entire student body and you prevent any infection of faculty or staff, which hasn't really occurred in any of the universities. The faculty and staff have been infected in their communities, just like the long-term care facility staff. So thank you very much. Thank you for really the work and the word that you're getting out there to really encourage people to continue to follow these really critical guidelines of wearing a mask, protecting others, and physically distancing, as well as washing our hands. But that physical distance and the mask are critical. Thank you very much.
Thank you.